South Korea's new cases of COVID-19 today again totaled more than 3,000, and the number of people severely ill rose to a record high of 661. ICU beds are near capacity across the country, so the health authorities are letting more people with lighter symptoms recover at home. Choi Won-jong has the details.
661. That's the number of patients with severe COVID-19 symptoms reported on Tuesday in South Korea, a record high since the pandemic began. That's 32 more than the previous day. Among Tuesday tally, more than 84% are among people aged 60 or over. As the country has already raised the pandemic's risk level from high to very high, health authorities are concerned about waning vaccine immunity as well as ICU hospital bed shortages. ICU beds nationwide has edged closer to full capacity. More than 90% are occupied in Seoul, while beds across the nation are now close to being 80% full. As of Tuesday, more than 86% are full in Gyeonggi-do province and over 83% in the city of Incheon. Chungcheong-do province region's medical capacity is close to breaking point, with more than 95% ICU beds in use, and there are no beds available in the city of Daejeon. To secure enough beds for severely ill, the government has decided to expand the scope for people with lighter symptoms to recover at home. Currently, a total of 5,452 people have been recovering at home. But compared to the figure from just a month ago, the number has jumped almost 5 times. Meanwhile, Korea's education officials are also on their toes, seeing a growing number of infections among students nationwide. More than 86% of the total students from elementary to high schools in Seoul are back in classrooms. But during the last week, 1,090 students have been confirmed with COVID-19, mostly catching the virus from their family members. There are 44 more COVID-19 deaths reported on Tuesday, raising the death toll to over 3,600. While most deaths have been among people aged 80 and above, health authorities are carrying out epidemiologic investigations on a first COVID-19 death reported in a child under the age of 10. Choi Won-jong, Arirang News.